Do you ever wake up in the middle of the night feeling unusually thirsty, needing to use the bathroom constantly, or even drenched in sweat? These might seem like minor annoyances, but for many over 60, they could be subtle yet significant clues your body is sending about a common, serious condition: diabetes. Ignoring these nighttime signals could mean missing crucial early warnings. Stay with us, because understanding these signs can truly make a life-changing difference. I'm Dr. Amanda Foster, and today we're going to talk about something incredibly important for your health, especially as we get older: the often overlooked signs of diabetes that can appear specifically at night. Many people don't connect their nighttime disturbances to their overall health, but your body works around the clock, and the night can reveal hidden issues. Understanding these nocturnal indications can provide valuable insight into potential underlying health problems, allowing for earlier detection and management. One of the earliest and most common symptoms of diabetes is an increase in urination, especially at night. If you find yourself waking up multiple times to empty your bladder, disrupting your sleep, this could be a significant sign. When you have diabetes, an excess of sugar, or glucose, builds up in your bloodstream. Your kidneys, which are amazing filters, have to work extra hard to filter and reabsorb this excess sugar. However, if your kidneys can't keep up with the high sugar levels, the excess glucose is excreted into your urine. This process also draws more fluid from your tissues, leading to a greater volume of urine and, consequently, more frequent trips to the bathroom. This physiological response is your body's attempt to eliminate the excess sugar, and it serves as an important warning sign of diabetes. It's not just about inconvenience, it's about your body signaling an imbalance. Another crucial symptom to pay close attention to is night sweats. If you frequently wake up in the middle of the night drenched in sweat, even when your room isn't warm, this could be an indicative sign of diabetes. Night sweats often occur due to low blood sugar levels during the night, a condition known as nocturnal hypoglycemia. This happens because your body releases emergency hormones such as adrenaline in response to dangerously low sugar levels. These hormones trigger symptoms like sweating, tremors, and a rapid heartbeat. These episodes can be unsettling and severely disrupt your sleep quality. Adjusting the dosage of medications or making changes to your dietary habits can help manage night sweats in people with diabetes. However, it's absolutely vital that these changes are only made under professional medical supervision from your doctor. While night sweats and tremors are common, other symptoms of hypoglycemia can also manifest during the night. These can include a notable increase in hunger, confusion, difficulty thinking clearly, blurred vision, and even heart palpitations. Hypoglycemia, which literally means low blood sugar, is a condition most frequently associated with diabetes. The reason these symptoms often appear primarily at night is due to your body's ongoing need for energy even while you're resting. When glucose levels drop too low, your body responds by displaying these symptoms, trying to signal the need for an increase in blood sugar. Managing these symptoms involves regular monitoring of your blood sugar levels and maintaining a balanced diet throughout the day. Additionally, it's crucial to discuss any medications you're taking with your healthcare professionals, as some medicines can significantly affect blood sugar levels. In some cases, a carefully planned nighttime snack containing complex carbohydrates and proteins might be recommended to help keep blood sugar levels stable throughout the night. But again, always consult your doctor first. The fourth sign we need to discuss is restless leg syndrome, or RLS. This is a neurological disorder that, while often underestimated, is quite widespread. It's characterized by an uncontrollable and often irresistible urge to move your legs. This impulse is usually accompanied by strange and uncomfortable sensations deep within the legs. These sensations are often difficult to describe, but many people compare them to crawling, tingling, aching, or even an electric-like feeling. You might be wondering about the connection between RLS and diabetes. The link actually lies in your nerves. Persistently high blood sugar levels, a hallmark of uncontrolled diabetes, can damage the nerves in your body over time. This condition, known as peripheral neuropathy, is a common complication of diabetes and can lead to the development of RLS. The damaged nerves send confusing or contradictory signals to your brain, leading to that insistent sensation of needing to constantly move your legs. So, if you're experiencing discomfort or an irresistible urge to move your legs, especially at night when you're trying to rest, it might be a good idea to have your blood sugar levels checked by Dr. Amanda Foster. A serious sleep disorder called sleep apnea ranks 5th on our list. This is a sleep-related condition characterized by frequent pauses in breathing during sleep. These pauses, or apneas, can occur many times throughout the night, resulting in interrupted sleep and often leaving the individual feeling exhausted and unrefreshed the next day. The relationship between sleep apnea and diabetes is particularly notable. Scientific research has shown that individuals with diabetes, particularly type 2 diabetes, are much more likely to have sleep apnea. The reasons for this are multifaceted. One key factor is that both conditions are strongly associated with obesity. When excess fat accumulates around the neck, it can obstruct the airways, leading to sleep apnea. Furthermore, the metabolic disturbances caused by diabetes, such as insulin resistance, can directly contribute to the development of sleep apnea. Insulin resistance can lead to imbalances in the body's energy consumption during sleep, causing disruptions in breathing patterns. It's this complex interaction of factors that leads to a significantly increased risk of sleep apnea in people with diabetes. If you suspect you have sleep apnea, it's crucial to seek a diagnosis and treatment. Continuing our discussion, we come to the symptom of increased thirst, also medically known as polydipsia. If you frequently wake up at night with a dry mouth and feel unusually parched, this could very well be a telltale sign of diabetes. This occurs due to high levels of sugar in your blood, which forces your kidneys to work overtime to filter and absorb that excess sugar. When they can't keep up, the excess sugar is excreted in your urine, as we discussed earlier, and this process pulls fluids from your tissues. This results in more frequent urination, which can lead to dehydration and, consequently, that persistent feeling of increased thirst. Managing this particular symptom involves meticulous blood sugar control, regular monitoring, a balanced diet, consistent physical activity, and any medications prescribed by your doctor. It's essential to consult with your healthcare provider for the best ways to manage your specific symptoms. Do not ignore increased thirst, especially if it's accompanied by other symptoms of diabetes, because it's your body urgently telling you that something is wrong.
The 7th sign to be aware of is persistent fatigue. If you constantly feel tired and lack energy despite getting what you believe are essential hours of sleep, this can be an indication of diabetes. The fatigue associated with diabetes is primarily caused by your body's inability to effectively use glucose as a source of energy. When your body cannot convert the food you eat into energy due to a lack of insulin or insulin resistance, your cells are deprived of the glucose they need to function optimally. This cellular energy deprivation makes you feel constantly tired and sluggish. Managing fatigue associated with diabetes involves maintaining stable blood sugar levels, which can be achieved through regular physical activity, a balanced and healthy diet, and consistent checkups with your healthcare professional. It's also important to ensure your body gets enough restorative rest and that stress levels are kept to a minimum. Relaxation techniques and stress management are crucial components in controlling diabetes-related fatigue.
Dry mouth, medically known as xerostomia, is another notable symptom to be vigilant about. Characterized by a chronic absence or reduction of saliva, Individuals might frequently wake up with a parched mouth despite maintaining adequate hydration levels throughout the day. Potentially, this could be a significant sign of diabetes. The symptom occurs because high blood sugar levels can directly decrease saliva production, leading to that uncomfortable dry feeling. Additionally, as we've discussed, high blood sugar can lead to increased urination, which can then contribute to overall dehydration and, consequently, an even drier mouth. Managing this symptom involves maintaining excellent oral hygiene, staying thoroughly hydrated, and, if necessary, utilizing saliva substitutes or stimulants. Chewing sugar-free gum or sucking on sugar-free candies can also help stimulate saliva production. It is always recommended to consult with a healthcare professional, like Dr. Amanda Foster, for an accurate diagnosis and appropriate treatment plan for this condition.
General sleep disturbances.
The final point to consider is the emergence of general sleep disturbances. If you suffer from chronic insomnia, or if you're frequently confronted with other unexplained nocturnal worries, these issues could very likely be related to diabetes. Chronic sleep disorders are often observed in people with diabetes due to the body's impaired ability to regulate blood sugar levels, which can lead to either nocturnal hypoglycemia, low blood sugar, or hyperglycemia, high blood sugar. As we've learned, low blood sugar levels can trigger symptoms like sweating and tremors, which can abruptly wake you up in the middle of the night. On the other hand, high blood sugar can lead to frequent urination, resulting in multiple trips to the bathroom throughout the night, severely interrupting your sleep cycle. Managing these sleep disturbances generally involves improving overall blood sugar control through appropriate medications, dietary changes, and regular exercise. Therapies such as cognitive behavioral therapy for insomnia can also prove highly beneficial in combating persistent sleep difficulties. Therefore, if you're struggling with your sleep, it's fundamental to consider the possibility of underlying diabetes and consult a healthcare professional for an accurate diagnosis and targeted treatment.
In summary, the signs of diabetes that can appear specifically at night are numerous and important. Frequent urination, night sweats, other symptoms of hypoglycemia, restless leg syndrome, sleep apnea, increased thirst, persistent fatigue, chronic dry mouth, and general sleep disturbances. Remember, these symptoms are not definitive proof of diabetes, but they are crucial indicators that may signal the need for a medical consultation. It is always best to consult with a healthcare professional if you experience any of these symptoms. Diabetes is a condition that affects millions of people worldwide, and being attentive to its signals, especially those that occur during the night, can significantly help with early detection and timely treatment. Don't wait. Your health is your most valuable asset. If you found this video helpful, please give it a thumbs up, share it with someone who might benefit, and subscribe to our channel for more trusted health advice from Dr. Amanda Foster. We're here to help you live your healthiest life. Thank you for watching.